Hello, coders, and welcome to Medicine Section Part 1. Because the Medicine section is different from the rest of the CPT book, we're going to be looking at things a little bit differently today. We're going to start by looking at the section names, the main terms you're going to find them under, what you need to know, and then we're going to get into the guidelines themselves. The issue with medicine is everything that is not evaluation and management, anesthesia, surgery, pathology and laboratory, or radiology. But it does have some radiology in it because remember, the cardiovascular system is in 3 sections. We're going to find cardiovascular in surgery, in radiology, and in medicine. Most of the things we're going to see here are going to be testing. We're also going to see our vaccines here. We're also going to see psychiatry, ophthalmology. And so as we go through, we're going to talk about each and every little section and what we need to know. So the first section that we're going to come up to is the immunoglobulins, serums, or recombinant products. The main term for these are immune globulins. Now, a lot of people ask me, how do you know it's an immunoglobulin versus a vaccine? Well, the provider has to tell you that information because they have to give us the exact product name of what they're going to inject into the patient. So they have to tell us it's an immunoglobulin versus a vaccine. Now, the difference between these also is that immunoglobulins are made from human or animal blood versus vaccines are viruses that we use things like chicken eggs to grow them in. Now, for both sets, the immunoglobulins and for the vaccines, we need 2 codes. When we do injections, when we do infusions, when we give a shot of something, we always have to have 2 codes. One is for the administration, so that is the provider or the nurse or the medical assistant preparing that product to go into the needle or getting the IV bag set up. And then we also get paid for what is inside of that needle or that IV bag. And the administration codes range. Some insurances only pay a few dollars, some will pay $15, $20 for an administration. So we pair these together with what is inside. So first we need administration and then we need the product. The big thing here is the immunoglobulins do not use the same administration codes as the vaccines. Okay, so I'm going to scroll down so we can look at these guidelines and then we'll come back. So, as you can see, we must use 2 codes. So it reminds us, codes 90281 to 90399 identify serum globulins extracted from human blood or recombinant immune globulins, product created in a laboratory through genetic modification of human and or animal proteins. Both are reported in addition to the administration code that they list afterwards. It's also important to note modifier 51 should not be reported with this section of product codes when performed with another procedure. Okay, so you can see I've written page 680. Page 680 is where the administration codes start, and I'll scroll down for a minute so you can see. This is one of the most common ones because this is the subcutaneous or intramuscular. This is not the only one. Obviously, there's a whole list of them. If someone is getting this intravenously, then we're going to have it for intravenous. If someone is getting this through a central venous port, we have that as well. But again, this is not clear when we're looking at the guidelines. So this is the most common code. We're going to use this code for anything that's subcutaneous or intramuscular injection. 12 shots, depot shots, and also most of these immunoglobulins and serum recombinant products. Okay, so again, it also says immunoglobulin right in the description. It tells us where it comes from, human, for intramuscular use. So again, we have to match up the way that we're getting it into the patient with the administration code. Okay, we don't put an intramuscular administration for an intravenous product because again, they're different costs depending on how much we're putting in. You can see we have intramuscular versus intravenous versus subcutaneous infusions. Again, we need to know from the provider, how did we get to the body? So again, most common is going to be what we've seen here, intramuscular, subcutaneous, and intravenous. Now, on the same page, again, we have the immunization administration for vaccines and toxoids. So these codes pair with the vaccine codes that start on page 604 in your code book. Again, we also need to use two codes, one for the administration, one for the vaccines, and that's what this guideline reminds us of, that we report vaccine immunization administration codes in addition to the vaccine and toxoid codes. Now, again, it goes on to remind us that a lot of these are going to be done while we're doing things like yearly physicals. So again, keep in mind, these can be used with evaluation and management codes. But if someone is just going in for a depot shot, a B12 shot, or a vaccine, we don't code for a visit because they didn't visit, they just got an injection of something. It goes on to remind us, again, if there is a significantly and separately identifiable E&M service, then we can append it. Now, a lot of people have to remember that when we are using an E&M code and a code from another section, such as medicine, we have to use modifier 25 with the evaluation and management code to tell the insurance company that the visit was separate from the reason for that injection, that vaccine, okay? If the patient is only there for the vaccine, we can't code an evaluation and management service. So again, the modifier 25 kind of links that and says, this is what the patient had done. They had a preventive medicine service, a yearly physical, and we gave them the vaccine. Pay us properly for both sets. Now, they go on to tell us, the component, okay, refers to all antigens in a vaccine that prevent diseases caused by one organism, okay? So again, when we hear about antigens, this is what causes the disease, and so we're using the vaccine to prevent this disease. So they go on to tell us multivalent antigens or multiple serotypes of antigens against a single organism are considered a single component of that vaccine. So for instance, we have a vaccine for Zika. It only has Zika in it, okay? That's a one organism. But we also have combination ones. So it tells us combination vaccines are those vaccines that contain multiple vaccine components. Conjugates or adjuvants contained in vaccines are not considered to be component parts of the vaccine as defined above. So for instance, a lot of us know about MMR, measles, mumps, and rubella. We all have to get it to go to school. And so that is a combination vaccine. It is one shot and all measles, mumps, and rubella are inside that vaccine. Now, unlike the immunoglobulins and serum recombinant products, the vaccines have separate codes to deal with the administration. The first set is for anyone under 18, but it has to be with counseling. And that's the most important part, okay? With counseling by physician or other qualified healthcare professional. So that's very important. So this happens mostly with younger children and usually with the first vaccine of a series of vaccines. So for instance, you know, when that baby gets their hepatitis B shot, the patients are, you know, the parents are counseled. If you should see redness, if they should run a fever, this is what you do. That's the counseling, okay? But if, let's say, the child is older and they're getting the HPV vaccine, usually the first time they come in, they're going to get counseled. And then the second and third time they come in, they're just going to get the vaccine. So again, we need to know whether or not there is actual counseling. There has to be documentation of this. So if you end up working in pediatrics, this is something very, very important. Also note the add-on code. 90460 is first or only component of each vaccine or toxoid administered. 90461 is each additional. So again, this is very similar to integumentary when we have to use a standalone code and an add-on code to describe more area of the patient's skin. And again, this is where the days or units becomes important because sometimes kids are getting 2, 3, 4 vaccines all at once, especially younger kids, between the ages of 2 months and 2 years, their children are coming in consistently to get properly vaccinated. So again, first one, each additional, you can use 90461 and you can times it by 2, 3, 4, however many additional vaccine administrations after the first one. However, no counseling leads us to 90471, and it's add-on code 90472. Couple things you need to know. This is, again, for any age without counseling, but these are all injections. You'll notice it says percutaneous, intradermal, subcutaneous, or intramuscular. Again, first vaccine. So this is only for the first one because it pairs with 90472 for each additional. And again, you can have this in a situation as well because the HPV vaccine is covered under most insurances up to age 26. So you might be in a primary care setting, a specialty care setting that does it, OBGYN. You also might be in family medicine. A lot of people forget family medicine are doctors who do birth on up. And so if you work in those, you're going to be using a combination of all these codes. But keep in mind, this is just the administration. We still haven't gotten the actual vaccine code yet. Now, there are some newer vaccines out there that are intranasal or oral route. These are considered inhaled. So, for instance, a couple of years ago, and it looks like it's coming back this year, they did the nasal spray for the live flu vaccine. They also have a little inhaler they use from time to time. And so 90473 and 90474 are used less frequently because a lot more immunizations are done by injection. However, this is where it gets a little tricky. If the patient is getting an injection and they're getting an inhaled, you have to make sure that we are using the correct code. So right here it says 90474 can be used in conjunction with 90460, 90471, and 90473. Do not report 90473 in conjunction with 90471. So here's the thing. You can only use one of the two standalone codes, and then you can use either of the add-on codes. It's all dependent on the type of vaccine the patient's getting and how they're getting it, the route of administration. So again, 90473 and 4 are any age with counseling. This is inhaled, okay? So let's go back to the top for a minute. So keep in mind, immunoglobulins use separate administration codes. We have the immunization administration codes, which pair with the vaccine codes. Then we're going to have the vaccine codes. But when it comes to the administration of the vaccines, if they're under 18, counseling needs to be taken into account. If there's no counseling or they're of any age, then it's route of administration for the administration codes, okay? Now we're going to look at the vaccines and toxoids. For these, we're going to look under the main term of vaccine, but again, there's a lot of combination vaccines. Now, the provider usually has like a sticker or a little piece of paper that they themselves or the nurse or the medical assistant can put into the system that tells us exactly what type of vaccine. So when you look at the vaccines and you see like there's 15 different types of flu vaccines, keep in mind your facility is probably only going to get one of those. So what you can do is at the beginning of the season or every quarter or so, you can make sure that you are aware of which vaccines are happening and when. For instance, the norovirus vaccine is given to children that are born in the winter, but usually not to children born in the summer. So again, you need to be aware of how all this flows. If you're dealing with vaccines, you really need to be updating more than once a year, and that goes to our next set of guidelines, which is on the bottom of page 603. Oops, sorry. that tells us that these are updated twice a year, July 1st and January 1st. So twice a year you can go down to this website and it will give you anything dealing with the FDA approval pending statuses and any other codes that are being released for that time period. So again, quarterly, just to make sure what's going on in your specific office, and then actually going to the website twice a year and making sure that you're aware of the vaccines. Goes on to remind us that these codes 90476 and 90749 identify the vaccine product only. So remember, to report the administration of the vaccine or toxoid, we have to use the 904 60 through 90474. And again, modifier 51 should not be appended. We can also do E&M services, as they remind us again. And the biggest thing is to remember that to meet the reporting requirements of immunization registries, vaccine distribution programs, or reporting systems, the exact vaccine product administered needs to be reported. Multiple codes for a particular vaccine are provided in the CPT code book when the schedule or the number of doses or timing differs for 2 or more products of the same vaccine, like hepatitis A or hemophilia influenza B, or the vaccine product is available in more than one chemical formulation, dosage, or route of administration. So again, you have to match up the type of administration with the exact product that we're giving the patient. It goes on to remind us. The when administered to age descriptions, including the CPT vaccine code, are not identified. The product's licensed age indication. The term preservative-free includes use for vaccines that contain no preservative and vaccines that contain trace amounts of preservative agents that are not present in sufficient concentration for the purpose of preserving the final vaccine formulation. So again, we always need to know the exact product. It also reminds us that there are separate codes for combination vaccine. And again, if it is a combination vaccine, meaning there's more than one type of vaccine in that vial, we have to use a combination vaccine code. It then goes on to remind us that it uses the ACIP, the Advisory Committee of Immunization Practices, recommendations on a yearly basis. And again, as we see here with things like the typhoid vaccine, it tells us intramuscular use. But then we have this one, which is diphtheria, tetanus toxoids, acellular pertussis vaccine, and inactivated poliovirus, which is known as DTaP-IPV. And again, this is to children 4 through 6 years of age for intramuscular use, versus this one, the FDA approval pending, includes diphtheria, tetanus, acellular pertussis, inactivated polio, hemophilia influenza type B, and hepatitis B for intramuscular use. So again, what is inside that vial? What are we giving? And again, matching up whether or not there's counseling if it's for a child or route of administration if it's an adult. And you'll see that most of these are intramuscular or subcutaneous. So let's go back to the top and refresh yet again. The vaccine codes are always paired with the administration codes, and we have to look out for combination vaccines. So when you go to the main term of vaccine in the back of the book and you don't find what you're looking for, read more carefully through it, because again, they're going to end up shortening it to the abbreviations they use for that vaccine. Now, as we come up to psychiatry, so we're going to see 3 main terms that we're going to use. Psychiatric diagnosis for the actual diagnostic portion where they're trying to figure out what exactly is going on with the patient. We also are going to see psychiatric treatment. This is going to be all different types of treatment, hypnotherapy, electroconvulsive therapy, you name it. And then psychotherapy, which is the talking therapy itself. And for these, we need to know the exact procedure or test that we're giving the patient. So let's look down at those guidelines. So I put a note on the top of my psychiatry every year. C codes 96101 to 96127 for neurofunctional testing. So The main part of psychiatry is at the beginning of medicine. We also have neurofunctional testing, and those are different types of testing that we do to see if there's a neurofunctional disorder, or we also do different types of screenings. So for instance, if you want to work for like the FBI or the CIA, or you're in a high government position, whether it's a state or federal level, you usually have to go through these neurofunctional testings to make sure that you're stable. A lot of Fortune 500 companies do this for their top CEOs. They want to make sure that you're going to be loyal to the company, that you know when you can't give out information. And we're also going to see stuff like looking at aggressive behavior in teenagers, and also looking at different developmental and neurofunctional disorders as well. So those pair with these psychiatry codes. So if you're not finding the type of testing under psychiatry, look under neurofunctional testing. So these guidelines tell us psychiatry services include diagnostic services, psychotherapy, and other services to an individual, family, or group. Patient condition, characteristics, or situational factors may require services described as being with an interactive complexity. Services may be provided to a patient in crisis. Services are provided in all settings of care, and psychiatric codes are reported without regard to setting. So again, these could be the office, this could be emergency room, observation, inpatient hospital, nursing home care, you name it. And so again, sometimes we can report some psychiatry services with evaluation and management services, but we have to be careful about that. It goes on to tell us that, again, some patients receive hospital evaluation and management services only, and others receive hospital evaluation management services and other procedures. So if we're doing other procedures such as electroconvulsive therapy or psychotherapy, in addition to the hospital evaluation and management services, these may be listed separately. So we could do like a 99221 with the electroconvulsive therapy code. Keep in mind, though, consultation for psychiatric evaluation of a patient includes examination of a patient and exchange of information with the primary physician and other informants, such as nurses or family members, and the preparation of a report. These services may be reported using consultation codes. So, one of the things we have to remember before we get into this section is that when it comes to psychiatry, psychotherapy, counseling, those situations are not the same as regular medical care. When it comes to these types of situations, a lot of times they have to ask other people. If someone is in a very manic stage and they're severely anxious, they might not be able to explain what's going on or what happened. But let's say a family member or a friend saw what happened, or the patient was able to explain to them earlier. So psychiatry, psychology, counseling, all of these types of situations, we're not just talking to the patient, we're talking about anyone else who has knowledge of this situation the patient has been in, or what brought them to the office or facility. So that's the first thing we need to keep in mind. So these codes are mainly going to be used by all different types of licensed counselors, psychologists, psychiatrists. Remember, a psychiatrist is a medical doctor that has specialized in the mind, versus a psychologist and a licensed counselor usually have a master's degree or PhD, but they are not a medical doctor. So keep that in mind. The main difference is psychiatrists can actually prescribe medication. Psychologists and counselors cannot prescribe medication. Now, we have this code 90785 as an add-on code for interactive complexity to be reported in conjunction with codes for diagnostic psychic evaluations, psychotherapy, and psychotherapy when performed with an evaluation management service, and group psychotherapy. So what is this? Interactive complexity refers to the specific communication factors that complicate the delivery of psychiatric procedures. Common factors include more difficult communication with discordant or emotional family members. So again, people that are severely upset or refuse to talk. Engagement of young and verbally undeveloped or impaired patients. So again, young children, anyone with special needs, people who don't have the verbal ability to get that information out. Typical patients are those who have third parties such as parents, guardians, other family members, interpreters, language translators, agencies, court officers, or schools involved in their psychiatric care. Now, these factors are typically present with a patient who have other individuals who are legally responsible for their care, such as minors or adults with guardians, or request others to be involved with their care during the visit, such as adults accompanied by one or more participating family members, interpreters, or language translators, or require the involvement of other third parties, such as child welfare agencies, parole or probation officers, or schools. So those are the three most common situations we're going to see. Now, psychiatric procedures may be reported with interactive complexity when at least one of the following is present. Either the need to manage maladaptive communication, like high anxiety, high reactivity, repeated questions, or disagreements among participants that complicate the delivery of care. Caregivers' emotions or behaviors that interfere with the caregiver's understanding and ability to assist the implementation of the treatment plan. Evidence or disclosure of a sentinel event and mandated report to a third party, like abuse or neglect, with a report to a state agency. The initiation of discussion of that sentinel event and or report with the patient and or other visit participants. The use of play equipment, other physical devices, interpreter or translator to communicate with the patient to overcome barriers, therapeutic or diagnostic interaction between the between the physician or other qualified healthcare professional and the patient, who is either not fluent in the same language as the physician or other qualified healthcare professional, or has not developed or has lost either the expressive language communication skill to explain his or her symptoms in response to treatment, or the receptive communication skills to understand the physician or other qualified healthcare professional if he or she were to use typical language for communication. So again, think children, young children who can't properly formulate the words. Now, it goes on to let us know that when provided in conjunction with psychotherapy, the amount of time spent by the physician or other qualified healthcare professional providing interactive complexity should be reflected in the time service code for the psychotherapy or the psychotherapy add-on codes. Okay, so psychotherapy codes are based upon time. So again, we have an add-on code 90785 for interactive complexity. Then we come upon our psychiatric diagnostic procedures. And again, this is an integrated biopsychosocial assessment that includes history, mental status, and recommendations. The evaluation may include communication with family or other sources and the reviewing and ordering of diagnostic studies. A psychiatric diagnostic evaluation with medical services is an integrated biopsychosocial and medical assessment that includes history, mental status, other physical examination elements as indicated, and recommendations. The evaluation may include communication with the family or other sources, prescription of medication, reviewing and ordering of laboratory or other diagnostic studies. Again, in certain circumstances, one or more informants, like family members, guardians, or significant others, may be seen in lieu of the patient. So we have code 90791 and 90792 may be reported more than once for the patient when a separate diagnostic evaluations are conducted with the patient and other informants. So again, it goes on to tell us, because again, this is a biopsychosocial. So this is looking at the physical body and the emotional body, okay? And so these cannot be reported on the same day by an evaluation and management service by the same provider. So this is kind of an all-in-one. So it's a diagnostic workup that includes an evaluation and management code. And again, you'll see the stars. These can also be done by telemedicine. So we have our psychiatric diagnostic evaluation or a psychiatric diagnostic evaluation with medical services. And again, always look for your notations for the do not reports. So again, diagnostic workup, we're trying to find out what the problem is. Psychotherapy is the treatment of mental illnesses and behavioral disturbances in which the physician or other qualified healthcare professional, through definitive therapeutic communication, attempts to alleviate the emotional disturbances, reverse or change maladaptive patterns or behavior, and encourage personality growth and development. And these can be done by a variety of ways. A lot of it's done by talk therapy, where the patient just talks and the psychotherapist or counselor kind of prompts them into different topics as they kind of proceed in telling what's going on. Now, the psychotherapy service codes 90832 to 90838 include ongoing assessment and adjustment of psychotherapeutic interventions and may include involvement of informants in the treatment process. Now, we have a whole set of codes for the individual patient. We also have codes for the family. Okay, here's a big thing right here. Do not report 90846 and 90847 for family psychotherapy less than 26 minutes. So these codes have to hit the time component. As it goes on to tell us, in reporting, choose the time closest to the actual time. Okay, so 16 to 37 minutes, 38 to 52 minutes. So again, when you go through and you look at these codes based on time, keep in mind, we're going to be able to round up a little bit with these codes, okay? Now, they go on to tell us that the medical symptoms and disorders inform treatment, choices of psychotherapeutic intervention, and data from therapeutic communications are used to evaluate the presence, type, and severity of the medical symptoms and disorders. For the purpose of reporting, the medical psychotherapeutic components of a service may be separately identified as follows. The type and level of E&M service is selected first based on the key components of history exam and medical decision making, and time associated with the activities used to meet criteria for the E&M service is not included in the time used to report the psychotherapy. Okay, so again, this cannot be part of the medical decision making time spent in general. So again, this is separate. So we have to know that this is a separate, significantly identifiable E&M service on the same date as a psychotherapy. However, a separate diagnosis is not required for the reporting of E&M and psychotherapy on the same date of service. So again, we can see psychotherapy, 30 minutes with patient, psychotherapy, 30 minutes with patient when performed with evaluation and management. Again, 45 minutes, 45 with E&M, 60 minutes with E&M. And then we get to psychotherapy for crisis. So psychotherapy for crisis is an urgent assessment and history of a crisis state, a mental status exam, and disposition. The treatment includes psychotherapy, mobilization of resource to diffuse the crisis and restore safety, and the implementation of psychotherapeutic interventions to minimize the potential for psychological trauma. The presenting problem is typically life-threatening or complex and requires immediate attention to a patient in high distress. Okay? So it tells us that these codes, 90839 and 90840, are used to report the total duration of time face-to-face with the patient and or family spent by the physician or other qualified healthcare professional providing psychotherapy for crisis, even if the time spent on that date is not continuous. This is very similar to, again, our E&M. So they can meet with the patient for a half hour, leave for a little bit, come back and meet with the patient for an hour. So we would add up all of that time. Again, it goes on that the healthcare professional or physician must devote their full attention to the patient. So again, this is face-to-face time with the patient and or family. Code 90839 is used to report the first 30 to 74 minutes of psychotherapy. For a crisis on a given date, it should be used only once per date, even if the time spent by the physician or other qualified healthcare professional is not continuous on that date. Psychotherapy for crisis of less than 30 minutes total duration on a given date should be reported with 90832 or 90833. Okay, so again, very similar to how our critical care services run. Okay, we have a standalone code we use once, and then we have an add-on code for each additional set of time, which in this case is each additional 30 minutes. Again, if it's less than 30 minutes in general, what we're going to do is we're going to go back to the diagnostic services. Okay, so again, big thing for psychiatry is making sure that we're getting the exact type of counseling or the exact procedure. And again, for a lot of these codes, time is of importance. Now, there's one little section of biofeedback. There's no guidelines, there's only 2 codes. So, biofeedback is a way of training the mind to train the body. So, for instance, if a woman is having issues with a prolapse, whether it's a uterine prolapse, cervical prolapse, or vaginal prolapse, a lot of times the doctor might suggest that woman do Kegel exercises, which is when you clench the muscles in your pelvic area and you hold it clenched for as long as you can, and then you release, and you do that multiple times a day, and that helps strengthen the muscles and helps strengthen the floor of the pelvis. Men can also do these as well. So that would be more of 90901, where we're giving a specific technique to do biofeedback. Another thing that we can do is we can learn how to calm ourselves down. Okay, if let's say in certain situations our blood pressure spikes really high, what we can learn to do is we can learn how to identify those problems and how to be able to calm down so that we can bring our blood pressure down as we calm down. That would be another thing of biofeedback. Okay, but 90911 is biofeedback training of the perennial muscles, anorectal or urethral sphincter, including EMG and or manometry. So this is specifically looking at the perennial muscles, the anorectal or the urethral sphincter. And usually what they're doing, again, they're looking at electromyography. So they're looking at, is there a problem with the muscles in those regions, the perennial, the anorectal, or the urethral sphincter. So this is going to be done more often for both fecal and urinary incontinence. Okay, and we're going to see, what happens to the patient. And in that testing, we're also going to hopefully give them some training of how to deal with those certain situations. There's only 2 codes. It's under biofeedback. Now for dialysis. Most common dialysis is hemodialysis. So hemodialysis is when we take the blood out of the patient, we put it into a machine, and the machine does the function of the kidneys, where it's going to do its absorption and reabsorption in the bloodstream. It's going to get out the impurities. It's going to get out what would turn into urine, and then we put it back in the body as clean blood. So we have a couple different sets of codes because we can use hemodialysis for acute settings like acute kidney failure. That happened a couple years ago. There was a gentleman who was dared to drink a 1.75 liter bottle of soy sauce, and he did, and he immediately collapsed. He was brought to the hospital, and the first thing they did was put him on a dialysis machine, on hemodialysis, to get that extra sodium out of his body before he had a heart attack. So we can do these for short-term scenarios like that. Most commonly, these are done for chronic kidney disease and the ESRD, end-stage renal disease. Okay, but we have a couple different sets of codes. So as we go through, we're going to talk about each set of codes. So these codes are the different evaluations that we do. So 90935 and 90937 are reported to describe the hemodialysis procedures with all evaluation management services related to the patient's renal disease on the day of the hemodialysis procedure. These are used for inpatient ESRD and non-ESRD procedures for outpatient non-ESRD dialysis service. Okay, so 2 things. Number 1, if an end-stage renal disease patient goes into the hospital, we use these codes. The other scenario is if you're working in a dialysis center outpatient, which is more common because they're all over the place, then you will use these for everyone who doesn't have end-stage renal disease. So again, this could be chronic kidney disease stage 3, or this could be due to a toxicity or a poisoning or something like that. So 2 different scenarios here. Again, you can also use these with evaluation and management codes as long as you're using modifier 25 to say a separate and significantly identifiable E&M service at the same day at the same time. And so again, these are based off a single evaluation or repeated evaluations with or without substantial revision of dialysis prescription. So if the patient's in the hospital and the doctor visits with them and everything's good and they're stable, it's going to be a 90935. However, if the doctor has to keep checking on them and revise their prescription, we're going to use 90937. We also will see the hemodialysis access flow study. This is when we've created that arteriovenous fistula, usually in the wrist area. And again, that's something that we specifically do in the cardiovascular surgery, but this is testing. Remember, a lot of medicine is testing. Now, we have some miscellaneous dialysis procedures. Okay, so these are specifically for things that are other than hemodialysis, okay? Peritoneal dialysis, hemofiltration, or continuous renal replacement therapies, and all evaluation management services related to the patient's renal disease on the day of the procedure. Okay, so again, when we look at these codes, they can be used with other E&M codes as well. And you can see here under the 90947, dialysis procedure other than hemodialysis. Again, peritoneal dialysis, hemofiltration, and other continuous renal replacement therapies. So 90945 is for one evaluation, 90947 is for multiple with or without revision of the prescription. And so again, different types of issues with the kidneys lead us to whether or not the patient can do hemodialysis or another type of dialysis. So again, we need to be clear from the provider's documentation, what type of dialysis procedure do we have and what is the circumstance of the patient. When it comes to the actual end-stage renal disease services, so these are people who are statused as end-stage renal disease as their main diagnosis for dialysis. So codes 90951 to 90962 are reported once per month to distinguish age-specific services related to the patient's end-stage renal disease performance in an outpatient setting with 3 levels of service based on the number of face-to-face visits. Okay, so the NTK need to know. You need to know the age of the patient and how many visits, but these are only reported once per full month of service. Okay, now, there are new or revised guidelines, okay, that tell us that these codes are to remind us that each month is considered 30 days. So these codes 90967 to 90970, which come at the end of hemodialysis of ESRD services, for less than a full month of service per day for services provided under the following circumstances. So either it's a transient patient, okay, so I've worked in a variety of primary care facilities where a patient is a snowbird, where they live in New England for part of the year and they live down in the south like Florida for other parts, and a lot of times they're leaving part way through the month. So we can't code for a full month of service if we work for the dialysis center. We have to code for each day they came in. Or a partial month or 1 or more face-to-face visits without the complete assessment, or the patient was hospitalized before complete assessment was furnished. Again, a lot of patients with ESRD, they'll go multiple times a week. So they'll go Monday, Wednesday, Friday. I worked in an office years ago where we had a patient who was supposed to go Monday, Wednesday, Friday for dialysis. But on Friday, she always somehow found a way to not go. There was something to do. And so what would happen a lot of the times is by Saturday evening, she would start feeling toxic. She would end up in the hospital. And they would end up doing dialysis for her. And then back on Monday, she'd be coming to our office and going to regular dialysis. And so, these things do happen. Or if dialysis was stopped due to recovery, which is what we want, or death, which is not what we want, or the patient receives a kidney transplant, which we do want. Now, again, each month is considered 30 days. So keep that in mind. If you work for a dialysis center, it's 30 days is a month. Okay. Then we have some lovely examples that you can read through. When we get to the codes, what I like to do is I like to highlight the age and the amount of face-to-face visits. And they go from the most face-to-face visits to the least. And this is backwards from what we're used to. So in evaluation management, we're used to, as the codes go up numerically, they go up in complexity. In this case, it's swapped. So the first code is 4 or more visits in the month. The first indented code is 2 to 3, and then the next one is 1 visit. Again, we have another set of codes, 2 to 11, with 4 or more, 2 to 3, 1. And then we get to these codes right here. This is less than a month of service. So again, we want to make sure we always know what's been going on with the patient. And that's why it's important that we have all this documented when we're coding for these facilities. Again, all those codes are going to be under dialysis. Keep in mind what specifically is going on. Are they an inpatient? Are they non-ESRD? Are they an ESRD patient? Are they doing hemofiltration? What are we doing for the patient under dialysis? Now, let's go back up and look at our document. So again, for biofeedback training, we look under biofeedback training with or without the anorectal testing. For dialysis, we can look under dialysis and end-stage renal disease. Again, hemodialysis or peritoneal, we need to know the age of the patient and how many face-to-face visits with the physician per month. The next set of codes, which is gastroenterology, does not have any guidelines, but there are 3 main terms you're going to find things under. Gastroenterology diagnostic, gastroesophageal reflux test, and gastrointestinal exam. For all of these, we need to know the exact procedure that we're doing. So as we look at these, I went too far. Okay, there we go. So we get to gastroenterology. Again, all different types of studies. Most of these are different types of studies. So what exactly are we doing? Are we doing esophageal motility, where we see how the esophagus is functioning? Again, a lot of times we have the patient eating or drinking something. We have gastric motility and duodenal motility, where again, we're manometric, we're measuring the actual movement through the gastrointestinal system. We have the different, the acid perfusion test and the gastroesophageal reflux test. The 91034, they have a picture of this at the bottom. That is right here that you can't see. But again, they stick a probe down into the esophagus and they put it right through the lower esophageal sphincter and they let it sit there and they see what happens, how much acid comes up and hits that area. You know, so when we look at gastroenterology, again, what are we doing? We have breath hydrogen tests, we have gastrointestinal tract imaging. What specific tests are we doing? Then we get to ophthalmology. So ophthalmology is a little different because they do not use evaluation management codes. They have their own versions of evaluation and management codes. So our ophthalmology guidelines tell us that we have an intermediate ophthalmological service, which describes an evaluation of a new or existing condition complicated with a new diagnostic or management problem, not necessarily related to the primary diagnosis. This is going to include a history, general medical observation, external ocular and annexal examination, and other diagnostic procedures as indicated, and may include the use of mydriasis for ophthalmoscopy, which is the dilation of the pupil. And so again, as they give us in examples here, they're going to, again, do a general medical examination. We're going to tell them about our other issues because they may or may not impact the health of our eyes. They're going to do the external look. Again, a lot of times they use different lenses and different lights to be able to look into your eye, different mechanisms, that's all included. They can do mydriasis, so they can dilate the pupil if they want to, it's all included. Okay, and when we see things like biomicroscopy, that's when they're looking through a microscope into the eye and shining a very bright light so they can actually look at the back. They can look through all of the different areas of the eye and look for eye health. A comprehensive ophthalmological service is an intermediate service and more. So again, this is a comprehensive service which constitutes a single service entity, but need not be performed at one session, because a lot of times if they want to do more than one test on the same date, after they've dilated the eye, they can't do certain testing. So these can happen on different dates. So if you work for ophthalmology, again, we're going to have to be careful on making sure, is the patient coming back to complete this service, okay? So the service includes history, general medical observation, external and ophthalmoscopic examinations, gross visual fields, and basic sensor motor examination. It often includes, as indicated, biomicroscopy, examination with psychoplegia or mydriasis, and tonometry. Always includes the initiation of diagnostic and treatment programs, which could be anything from eye drops, oral medications, surgery, glasses, contacts, you name it. Now, it goes on to remind us, intermediate and comprehensive ophthalmological services constitute integrated services in which medical decision-making cannot be separate from the examining technique used. Again, this is why we don't use E&M services. Itemized service components such as a slit lamp examination, keratometry, routine ophthalmoscopy, retinoscopy, tonometry, and motor evaluation is not applicable. So again, the slit lamp is another version of being able to look into the back of your eye. Obviously, a retinoscopy, we're looking at the retina. Tonometry, we're measuring the eye. Keratometry, we're looking at the cornea. Motor evaluation, that's usually when they have you literally move your eyes up, down, left, and right and follow their finger to make sure that you have that. So it goes on to remind us that we have other codes that tend to pair with these. So again, in the initiation of diagnostic and treatment programs includes the prescription of medication and arranging for special ophthalmological diagnostic or treatment services, consultations, laboratory procedures, and radiological services. So again, those diagnostic and treatment programs can include all of that. Then we have special ophthalmological services, which describe services in which a special evaluation of part of the visual system is made, which goes beyond the services included under a general ophthalmological service or in which special treatment is given. Special ophthalmological services may be reported in addition to general ophthalmological services or evaluation and management services. So again, if we do things like a fluoroscopy angioscopy, okay, and that's when we actually inject the patient with a contrast so they can see the vessels of the eye better. Again, we have new and established. Again, we have intermediate and comprehensive for both. Again, we have things like the fluoroscopy angiography, fundus photography, things like that. So we have all different types. We also are going to see things like other specialized services. This is for the prescription and fitting and or medical supervision of an ocular prosthesis, which is an artificial eye adaptation by a physician. Now, we can also see evaluation management services for this too. So this is different. If someone's coming in to either get fitted for or because we are checking in on their prosthetic eye, then these are the services that we are going to use. Again, we have other types. We have things like color vision examinations, dark adaptations examinations, and then we come up to our contact lens services, okay? So what's included? The prescription of the contact lens includes specification of optical and physical characteristics, such as the power, the size, the curvature, the flexibility, the gas permeability. It is not part of the general ophthalmological services. So all of this comes after we've done an ophthalmological service. The fitting of the contact lens includes instruction and training of the wearer and incidental revisions of the lens during the training period. Follow-up of successfully fitted extended wear lenses is reported as part of a general ophthalmological service. The supply of the contact lenses may be reported as part of the service of fitting. It may also be reported separately by the appropriate supply codes. So again, this is when HCPCS comes in. So when they're talking about the fitting of the contact lens, the instruction and training makes sense, and then incidental revisions. When I was in 9th grade, I tried contacts, and the first pair made my eyes burn. I think I went through about 7 to 10 different types of contacts when I was finally told by an ophthalmologist that my eyes were just too dry and it just wasn't going to work right now. And all of those times I went back, I started getting really worried because, again, well before I knew any of this stuff, about my parents having to pay for all these contact lenses, and then finding out that, again, it was all included because we kept having issues with the training period. So, we would try a lens, it might not burn for a day or two, but then it would eventually, and then we'd have to exchange it. So this is something that, again, for complications, patients might be coming back to make sure that their contact lenses fit properly. Remember, aphakia, no lens. So this means that their cornea has been removed most of the time. We also have spectacle services, of course. This is the prescription of lenses, when required, is included in code 92015. 92015 specifically states that, back to it, the determination of the refractive state. So it includes the specification of the lens type, so whether it's monofocal, bifocal, or others such as trifocals and transitions, the lens power itself, the axis, the prism, the absorptive factors. So again, is it going to be in the transitions where it changes into sunglasses? The impact resistance, is it made out of plastic? Is it made out of glass? Is it made out of polycarbonate fiber? And other factors that have to go in to that specific lens, okay? Now, that is the determination of the refractive state. So this is what we're doing when they're actually going through the eye exam. They're determining what type of glasses the patient needs, what type of lenses they need. But if we're fitting the spectacles, that's different. Okay, so that is a different code. So we want to keep that in mind. So when it comes to our ophthalmological services, we have to remember we can look under ophthalmology diagnostic or ophthalmoloscopy. We need to know what is included in ophthalmological service and the exact procedure. Okay, so again, we need to know what exactly are they doing. Now, when it comes to otorhinolaryngology, also known as ear, nose, and throat, we have quite a few different things that we're going to talk about. The first is, of course, you can look under ear, nose, and throat. You can look under audiologic function test. You can look under audiometry, hearing aid services, and hearing therapy. A couple things to remember. Number one, if it's for a cochlear analysis, we have to look out for the age. And again, we need to know the exact procedure that we're doing. So let's look at our guidelines. So it starts with the fact that diagnostic or treatment procedures are reported as evaluation imaging services, again, otoscopy, anterior endoscopy, tuning fork test, and removal of non-impacted serum are not reported separately. So the otoscopy is them looking into your ear. The anterior rhinoscopy is looking into your nose, again, with a light. Tuning fork tests, that's when they hit the tuning fork, put up to your ear, can you hear it? And the removal of non-impacted serum. So non-impacted serum usually can be flushed out, and a lot of times that's flushed out by a medical assistant. Those are all included in these diagnostic or treatment procedures. Okay, so we have to keep that in mind. The second we start using instrumentation, that's a little bit different. Okay, so those special otorhinolaryngologic services that are those diagnostic and treatment services not included in evaluation management service, including office or other outpatient services or consultations. So again, we have to remember we can pair these with an evaluation and management code. So we have a couple different types, and one of the big things that you have to remember with medicine is, yes, it's about the guidelines, but it's also about understanding the wording and making sure that we're connecting the guidelines to the code itself. So codes 92507 to 92526 are used to report the evaluation and treatment of speech sound production, so being able to produce sound, receptive language, being able to understand it, expressive language ability, being able to express yourself, and voice and resonance production, being able to actually form the words and get them out of your voice box, speech fluency, and swallowing. So again, this could be used for small children. This could be used for someone who's special needs, someone who's in a traumatic accident or injury, someone who had a stroke, lots of different reasons. Evaluations may include examination of speech sound production, articulatory movements of oral musculature, oropharyngeal swallowing function, qualitative analysis of voice and resonance, and measures frequency, type, and duration of studying. So again, they're looking at the movement of the tongue in the mouth. Can the person make the words properly? The oropharyngeal swallowing function, can they swallow? Because that's a big part of a lot of these issues. Okay, again, if someone has like a large tongue, they might have issues with swallowing, and that could lead to this. The frequency, type, and duration of stuttering. So again, if someone stutters, how often, what do they stutter? Is it a specific letter they stutter over, or what kind of brings it on? Evaluations may also include the patient's ability to understand the meaning and intent of written and verbal expression, as well as the appropriate formulation and utterances of expressive thought. So again, if this is a child and we're doing something developmental, we may want the child to be able to understand what we're saying and respond back. Now, goes on to tell us that codes 92626 and 92627 are reported for the evaluation of auditory rehabilitation status, determining the patient's ability to use residual hearing in order to identify acoustic characteristics of sound associated with speech communication. Okay, so again, that means they've lost some hearing or were born without some hearing, and now we're going to see what can they hear. So again, we can do different examinations. We can do them under general anesthesia. Again, treatment of speech, language, voice communication, or auditory processing disorder. Lots of different things we can look. The vestibular function tests are, looking at the vestibule inside the ear. The audiologic function tests, again, these are audiometric tests, so we're testing the measurement of sound. Listed below require the use of calibrated electronic equipment, recording of results, and a report with interpretation. Hearing tests such as whispered voice or tuning fork that are otorhinolaryngologic evaluation management services are not reported separately. All services include testing of both ears. Use modifier 52 if a test is applied to one ear instead of two, because again, it's a reduced service. They're supposed to be bilateral. If it's unilateral, we want to use modifier 52. We also might need to tell the insurance company what side. So keep that in mind. All codes except for 92559 apply to the testing of individuals. For the testing of groups, use 92559 and specified tests used. So for instance, most of us should remember putting on the giant headset and having to move our arms when we heard different noises. We did this every few years going from elementary into middle school. And so if there's a group testing like that, we're going to use 92559. And again, what specific type of test are we doing? Okay. Then we have the evaluative and therapeutic services. A lot of what medicine is, especially when we get to the cardiac section, is dealing with the things that we have already implanted in the body. When we're implanting a device that has a battery pack to it, we're going to have to tune that device to the patient. It could be a catheter for pain, it could be a pacemaker for the heart, or it could be a cochlear device. They have to be tuned and analyzed for the specific person. And usually these are done on a yearly basis. So they tell us codes 92601 and 92603 Describe the postoperative analysis and fitting of previously placed external devices, connection to the cochlear implants, and programming of the stimulator. Codes 92602 and 92604 describe subsequent sections for measurement and adjustment of the external transmitter and reprogramming of the internal stimulator. And again, these are based on age, younger than 7 years and older than 7 years. And again, here's the cochlear device. So again, we have to remember there's a processor in there, there's a battery pack, there's programming, and there's reprogramming to be done. We can also do a diagnostic analysis, again, to make sure it's functioning properly. All right, we will pick up the next section with cardiovascular medicine services.